Someone with gaps like yours should be grateful they're even allowed near patients. That is what Dr. Caldwell said 47 minutes before his entire world collapsed. Seattle General's oncology floor hums with fluorescent light and antiseptic sharpness. Cold steel beds reflect harsh overhead lights. The air tastes like bleach and stale coffee. Rachel Torres moves through her shift with minimal words, her hands never shaking as she adjusts 4 lines with the precision of someone who has done this 10,000 times. Her dark hair is pulled tight against her skull. She wears plain scrubs without embroidery or patches. A slight limp in her left leg is the only physical tell, the kind of limp that comes from shrapnel, not a car accident. In her right pocket, her fingers find the tarnished military challenge coin between patient checks. The metal is warm from her body heat. She touches it the way other people touch rosaries. The coin is the last thing she owns from her erased life. Rachel charts with meticulous detail. Every vital sign documented. Every medication logged to the minute. Every patient assessment written in language so precise it reads like testimony. She knows her charting will be scrutinized. She knows gaps in a medical record can create liability. She knows liability is something she cannot afford. She checks on 4-star General Marcus Webb in room for 12. He is recovering from experimental immunotherapy for stage 4 metastatic melanoma. His chart lists him as 72 years old, decorated Special Forces commander, admitted 3 weeks ago through the VA system. Rachel reads his service record, 3 tours, 2 combat deployments, classified operations spanning from 1998 through 2018. The type of record that has redactions on top of redactions. When she enters his room to adjust his foot drip, she notices the scarring pattern across his chest. 2 parallel lines crossing his sternum. The kind of scar that comes from open chest surgery. She pauses. Her fingers hover near the foresight. The scar is exactly 20 years old. The tissue has the pale, thin quality of tissue that has spent 2 decades healing. She saw that scar form once. She was the one holding the instruments while a field surgeon worked on a collapsed chest cavity. She was the one who performed mouth-to-mouth on an 8-year-old boy covered in dust and blood. General Webb's eyes are closed. She adjusts his oxygen saturation monitor. She checks the antibiotic drip rate. She does not let him see her hands pause. She does not let her breathing change. She moves with the terrifying fluid precision of someone whose training was designed to function under conditions where emotion becomes a liability. Pain level, she asks. He opens his eyes. They are a shade of grey-blue that reminds her of an overcast Afghan morning. 4. Used to be worse. I'll request an increase to your analgesic protocol. She says this with the flat tone of someone reciting procedure, not someone whose throat has suddenly become dry. The surgeon wants to assess your incision site tomorrow. Depending on healing rate, we may consider reducing your for antibiotics. You're not like the other nurses here. I do my job. She turns to leave. Her limp is barely perceptible. She has learned to hide it. She has learned to hide everything. The fluorescent lights hum overhead like insects. The sound is a constant background pressure against her eardrums. She has learned to hear it as white noise. Most people do not even register it anymore. At 1800 hours, Dr. Caldwell enters the oncology floor. His white coat is pristine. His smile is cold. His shoes are Italian leather, expensive enough that they cost more than Rachel's monthly rent. He moves with the confidence of someone who has never once been told no by an institution. His eyes scan the floor like he is calculating market efficiency. He finds Rachel at the medication station. Ms. Torres. Excellent timing. His voice carries the kind of honeycoated threat that sounds like friendliness to people not paying attention. I'm conducting grand rounds at 18:30. I'd like to showcase your charting as a teaching example. Specifically, your documentation standards for the web admission. Rachel does not ask why. She already knows. She has seen this pattern before. The way institutions protect themselves. The way people like Caldwell identify vulnerability and exploit it. Of course, she says. 32 minutes later, Rachel stands in front of 12 physicians while Dr. Caldwell projects her charting onto the wall screen behind him. He holds up her admission notes like evidence in a trial. Notice here, he says, pointing to a paragraph with his laser. The documentation of initial symptom presentation is sparse. We have dates. We have vital signs. But the clinical narrative lacks the depth we expect at Seattle General. He turns to face the assembled physicians. This is an example of insufficient documentation standards. Liability risk. If this patient experiences a complication, and the family reviews this record, what do we show them? What do we prove? The other physicians smile. Not at Rachel. At the performance. At Caldwell's competence. At his ability to identify a problem and articulate it clearly. Rachel watches their faces. She recognizes the expression. It is the same expression soldiers wear when watching someone else get torn down instead of them. Relief. Gratification. The pleasure of not being the target. Caldwell turns back to Rachel. These are the standards that separate professional institutions from chaotic ones, wouldn't you say? Yes, doctor. Perhaps we need to schedule a documentation review for you. Before you continue charting on our critical cases. Rachel does not respond. Responding invites conversation. Conversation invites further attack. She has learned this too. The other nurses on the floor have already turned away. Nobody meets her eyes. The physicians file out of the medication station in clusters, already moving on to the next floor, the next scandal, the next demonstration of hierarchy. But Caldwell does not leave. He waits until the floor is quieter. He waits until Rachel is alone by the vending machine, restocking her water bottle for the second half of her shift. Then he approaches with the fluid movement of someone who has choreographed this confrontation many times before. Let me be direct with you, he says, his voice low enough that only she can hear. Someone with gaps like yours in their work history shouldn't be surprised when security escorts them out. We have a responsibility here. To our patients. To our standards. To the reputation of this institution. He pauses. He lets the threat settle. I have already made some phone calls. Checking your references. Verifying your credentials. Rachel takes a sip of water. The bottle is cold against her lips. She has learned not to flinch when someone is threatening her. Flinching is an admission of fear. Fear is a vulnerability predators can taste. I understand, she says. Do you? His eyes are calculating now. There is something else underneath the surface civility. Something that looks like hunger. Because I don't think you do. I think you walked into this hospital thinking you could just integrate. That nobody would ask questions. But we ask questions here. We always do. He steps closer. Close enough that she can smell his cologne. Something expensive. Something that smells like money and power. Your references have been difficult to verify, he continues. Your employment gap from 2003 through 2018 is particularly concerning. 15 years. That is not a small discrepancy in a nursing career. That is a void. Rachel's hand moves to her pocket. Her fingers find the coin. She touches it the way other people touch courage. My references are legitimate, she says. Are they? Because the phone numbers I called were disconnected. The organizations no longer exist. The people I spoke to had never heard of you. He smiles. His teeth are very white. So here is what I think. I think you are someone who should not be working in a hospital. And I think I am going to make sure you are not working here much longer. He walks away before she can respond. That is the mark of a predator, they always leave their victims with no opportunity to defend themselves. That is where power lives. In the inability to respond. Rachel stands alone by the vending machine. The fluorescent lights buzz overhead. The sound is louder now. She can hear it with terrible clarity. The hum of electricity. The hum of institutions. The hum of systems designed to protect themselves. She returns to room 412. General Webb is sleeping. His face in repose looks vulnerable. The kind of vulnerability that only exists in sleep. She checks his foredrip. She adjusts his oxygen. She logs the vitals with meticulous precision. And she touches the challenge coin in her pocket. The coin is made from aircraft wreckage and shrapnel. It is tarnished black in places where the metal has oxidized. There is no rank printed on it. No unit insignia. No date. Just the weight of it. The heft of it. The terrible reminder of what it means to have been erased. 20 years ago, she was someone. She had a rank. She had a name. She had security clearance and credentials that could not be verified because they existed on servers that nobody outside of JSOC could access. 20 years ago, she pulled an 8-year-old boy from the collapsed market in Bagram and breathed life back into his body. She did not know his name. She did not know his family. She did not know that he would grow up to be a decorated officer while she disappeared into classified operations that would eventually consume her entire identity. The boy did not remember her. Why would he? He was 8. He was terrified. He was covered in dust and blood. She was just the Master Chief who saved him. Now she is just a nurse with gaps in her credentials and a limp that nobody asks about and a tarnished coin that means everything and nothing. General Webb stirs in his sleep. His hand clenches. The heart monitor beeps a steady rhythm. Stable. Consistent. Alive. Rachel stands at his bedside for exactly 90 seconds. Then she returns to the medication station. She continues her shift. She continues being the invisible person that institutions use and discard. But that wasn't the worst part. The worst part was what happened next. Dr. Caldwell's office occupied the northeast corner of Seattle General's administrative wing, floor-to-ceiling windows overlooking the San Diego skyline, expensive enough to make the point that competence was rewarded. He sat behind his mahogany desk at 1,015 hours, 3 pharmaceutical representatives arranged in the leather chairs across from him like supplicants before a throne. Marcus Chen from Triton Pharmaceuticals leaned forward, palms flat on the desk. The Becton protocol generates 340% markup on the billing codes when we bundle the infusion with the imaging studies. That's $75,000 per patient. The second rep, a woman named Svetlana whose surname Caldwell never remembered, nodded with the precision of someone who'd memorized spreadsheets. We've moved 47 patients through the oncology floor in 8 months. That's $3.2 million in pharmaceutical revenue, split 4 ways. Caldwell didn't smile, but something cold flickered behind his eyes like a reptile in deep water. The third rep, younger, nervous, shifted in his seat. The Medicare audits happen quarterly. We've never had a flag because the documentation is clean. Dr. Caldwell's team justifies every code. Caldwell steepled his fingers under his chin. Which is why we maintain our quarterly distribution. $100,000 per quarter. 4 quarters a year. 100,000 times 4. The math was elegant in its simplicity. Then Rachel Torres appeared on the oncology floor 6 weeks ago. A temp nurse with no verifiable work history, no references that traced back to anything, no employment record before this position. She moved through the ward with the kind of competence that didn't require explanation, for lines placed on first stick, medication timing exact, patient comfort prioritized in a way that made other nurses look sloppy by comparison. Worse, she noticed things. Unnecessary imaging orders. Medication combinations that seemed clinically questionable but profitable. Last Tuesday she'd flagged a billing code that didn't match the actual procedure performed. Nothing overt. Just a note in the chart, verify Becton bundling, imaging not done. One note. From a nurse no one had ever heard of. From someone whose background couldn't be verified. From someone who could disappear tomorrow and nobody would notice. Except she wouldn't disappear. She'd testify. Or worse, she'd contact the state medical board. Caldwell leaned back in his chair, leather creaking like old bones. The temp nurse on oncology has become a liability. The three representatives exchanged glances. Svetlana spoke first. Torres? What's the problem? She's competent, Caldwell said, and the way he said it made competent sound like a disease. She asks questions. She takes notes. She notices billing patterns. Chen's jaw tightened. She a whistleblower. She's a threat. Which means she leaves. Caldwell stood, movement fluid and controlled, the kind of calm that comes from knowing you have power and knowing how to use it. I'll handle it by end of shift. She won't be back. The representatives left with the satisfied expressions of men who'd entrusted their problem to someone with the resources to solve it. Caldwell checked his watch, 1,032 hours. He had 8 hours to destroy a temp nurse's credibility. 8 hours was more than enough. Rachel moved through the medication room at 1,430 hours, checking the Pyxis machine for the 1,500 antibiotic rounds, her hands moving with the muscle memory of someone who'd done this same task in 3 combat zones and 4 different hospital systems. She pulled the antibiotics for General Webb's infection protocol, 3rd-generation cephalosporin, compatible with his renal function, dosed at 2 grams for every 8 hours. She didn't hear Caldwell enter until his shadow fell across the medication counter. He filled the doorway with the kind of presence that made the air pressure change, his white coat pristine, his stethoscope draped like insignia, his expression carrying the particular cruelty of someone secure in his institutional power. I called your references, gaps. He said it loud enough for 2 nurses at the supply station down the hall to hear. Disconnected numbers. The hospital closed in 2019. The Military Record Office has no listing for anyone matching your credentials. Rachel's hand paused on the medication tray, but her jaw remained unclenched, her breathing steady. She didn't turn to face him. The State Medical Board opened a file this afternoon. Falsified credentials. Fraudulent employment history. Security will escort you out before your shift ends tomorrow. His eyes held the glitter of calculation, the specific pleasure of someone watching a threat dissolve. Rachel set the antibiotic tray on the counter with deliberate care, each vial aligned perfectly, not a single tremor in her hands. She turned to face him, her expression empty as clean glass. I understand, Doctor. 10 words. Each one perfectly measured, perfectly controlled. Not apologetic. Not defensive. Just acknowledgement of his authority, delivered in a voice that revealed nothing. She stepped toward the doorway. He didn't move. For 3 seconds, the space between them held the weight of something unspoken, something violent and constrained. Then Rachel moved around him with a kind of fluid precision that required him to step aside or make contact. He stepped aside. She returned to her station on the oncology floor, her face still empty, her movement still measured, while Caldwell watched from 10 feet away, monitoring her like a hawk tracks movement in tall grass. She was still a problem. But now she was a problem with an expiration date. The supply closet on the 3rd floor measured for feet by 6 feet, lined with crash cart supplies, blankets, gauze, the industrial smell of antiseptic so strong it coated the back of the throat like medication. Rachel locked the door at 2,147 hours and stood in absolute darkness for exactly 90 seconds. Her breathing came fast now, shallow and rapid, not matching the controlled rhythm she'd maintained for the past 6 hours. Her hands braced against the metal shelving, fingers pressing into the cool steel, and for 90 seconds, the only seconds she allowed, the composure fractured. Her breath came in gasps like she'd been running, and there was nowhere left to run. Her chest heaved. Her muscles trembled with the effort of containment. The tarnished challenge coin in her scrub pocket felt like it weighed 10 pounds, like it was burning through the fabric, like every person in this hospital could see it glowing in the dark like a radioactive marker. Master Chief Petty Officer Rachel Torres, dead officially since 2003, entombed in classified files so deep that no civilian database could reach her. 20 years of being someone else. 20 years of working in hospitals under borrowed names, staying invisible, staying gone, letting the world believe she died in Bagram with her entire unit. And now she was going to be fired from Seattle General for credentials that didn't exist because her actual credentials were buried under 6 layers of Pentagon classification. She pressed her forehead against the cool metal shelf, and the trembling wasn't fear. The trembling was restraint. The trembling was 20 years of military discipline refusing to let her scream. After 90 seconds, her breathing steadied. Her hand stopped shaking. She unlocked the door and returned to the oncology floor at 2,149 hours, her face empty again, her movements precise again, composed as surgical steel. No one had seen her break. No one would ever see her break. The pages started at 2,156 hours. Caldwell initiated them from his office, where he sat beneath his mahogany desk and made systematic phone calls to every attending physician on the night rotation. The messages were carefully worded, calibrated to trigger institutional fear in men and women who'd spent their entire careers protecting themselves from liability. This is Dr. Caldwell, Chief of Oncology. We have a patient safety concern on the floor. General Marcus Webb, 4-star Special Forces. Recommending case review meeting at 0300 hours to discuss malpractice exposure and liability containment. The messages continued. To Dr. Patricia Okafor, the senior cardiologist on call, potential adverse event. Patient chart shows documentation gaps. We need to discuss our exposure. To Dr. James Sterling, trauma surgery, recommend getting legal involved before this escalates. Malpractice concern. To Dr. Raymond Santos, intensivism, patient outcome trending negative. Discussing liability mitigation strategies. You should be present. The pages went out to every doctor who worked the night shift. Both cardiologists. 3 surgeons. For intensivists. 2 oncologists. 3 residents rotating through critical care. 15 physicians in total, each receiving the same message wrapped in different language, each message designed to communicate the same thing: this patient is a liability, and the hospital needs to protect itself. Caldwell didn't say, abandon this patient. Caldwell said, protect yourself. The difference was invisible until it wasn't. He sent the final page at 2,203 hours and settled into his chair to wait, checking his watch periodically, knowing that General Webb's deterioration would serve his purposes far better than any credentialing investigation. Some threats didn't require evidence. They just required fear. And fear, Caldwell had learned years ago, was the easiest currency to trade in a hospital. Fear moved faster than truth. Fear motivated faster than evidence. Fear was something every doctor in this building understood in their bones. The heart monitor alarm screamed at 02 for 5 hours like a warning siren nobody wanted to hear. Rachel heard it from the medication room down the hall, that particular high-pitched shriek that didn't mean watch this patient but meant this patient is dying right now. She moved without thinking, muscle memory older than her borrowed identity taking over, and pushed through the ICU doors into General Webb's room where the blue was already creeping up from his fingertips like frostbite in reverse. His chest heaved. His eyes rolled back until only the white showed, that terrifying blank stare of a body losing its fight for electricity. His lips had gone the color of a bruise, that specific shade that meant oxygen wasn't reaching anywhere it needed to go. Rachel had seen this look before, in Bagram, in field hospitals, in the eyes of soldiers who'd taken shrapnel to the chest and were running out of seconds to make a choice between living and dying. The general's hand clawed at the sheets. His mouth opened. Nothing came out but a sound like air escaping a tire. The crash cart was there in seconds. Rachel had already pressed the call button before she even knew she was doing it, and the response came like a swarm. The first cardiologist through the door with his stethoscope already in his ears, then the senior trauma surgeon, then the intensivists in a cascading wave of white coats and steady hands. They worked with the precision of people who'd done this 1,000 times, who could read each other's movements without speaking, whose hands knew exactly where to place the defibrillator pads and how hard to compress ribs and when to push the epinephrine. Rachel positioned herself at the forecart, hand steady as a surgical laser, pushing drugs into the line as the cardiologist called them out. 1 milligram epi. Push it. Again. The general's body arched with each shock like electricity was trying to teach his heart a lesson. The monitor traced its useless zigzag, that chaotic rhythm that meant the electrical system had stopped listening to commands. 15 doctors. That was the number that would matter later. 15 physicians from the entire night rotation, cardiologists, surgeons, intensivists, specialists from every corner of the hospital who'd been paged with the same urgent message Caldwell had sent 30 minutes earlier about liability exposure and malpractice risk. They came with the muscle memory of people trained to save lives, and they filled the ICU with a kind of organized chaos that looked like hope but felt, to Rachel's bones, like performance. She watched Dr. Caldwell move between them, not working directly on the general but orchestrating something else entirely, a symphony of departure disguised as emergency medicine. He whispered to the cardiologist. He showed his tablet to the senior surgeon, tapping something on the screen with his index finger. His pager buzzed and he held it up like a billboard, spreading the message through the room without speaking. 40 minutes. That's how long they kept the general's body moving. 40 minutes of chest compressions and medications and shocks to a heart that had stopped listening. Rachel watched the monitor the entire time, watched the numbers climb and fall, watched O2 saturation climb to 94 and then slide back down because no amount of bags and tubes could make a dead thing want to live again. The fluorescent lights hummed their mechanical drone overhead. Monitors beeped in their appointed rhythm, the sound of time passing in fractions of a second, each beep a moment the general was still theoretically in the game, still theoretically salvageable, still theoretically worth the effort. The smell of latex and sweat and that acrid metallic tang of blood hung in the air like a question nobody wanted to answer. At 0325 hours, Dr. Caldwell moved to stand beside the cardiologist at the head of the bed. Rachel heard him say it quietly, those 5 words that changed the entire equation, time of death, 0325. He didn't announce it to the room. He said it like he was sharing a secret, speaking directly to the cardiologist's ear as if the general's body couldn't hear him anymore, as if words didn't matter now that the heart had stopped. The cardiologist nodded. That nod was all the permission the room needed. Caldwell turned from the senior surgeon to the intensivist to the trauma specialist, moving through the ICU like a man making rounds, his voice low and urgent and threaded with something that looked like concern but tasted like calculation. His family will sue, Rachel heard him say to one doctor. We need to be clear we did everything possible. To another, experimental protocol. Document that we tried and failed. His pager went off again and he showed the screen to 3 different specialists, nodding like he was receiving orders from somewhere higher up the food chain. He was making calls now, his phone to his ear, speaking to voices on the other end of the line, names of board members and risk management and the hospital president. His network was activating in real time, spreading the message before anyone had even left the ICU. The exodus started at 8 minutes past the hour of death. Not all at once, that would have looked choreographed, would have looked wrong. Instead, one doctor peeled away, saying something about another patient, then another, then a third, until the ICU was emptying out like a room where someone had just announced the party was over. They filed past Rachel without looking at her, 15 physicians in the space of less than 10 minutes, all of them moving toward the door with the kind of purposeful stride that meant they had somewhere else to be, someone else to save, somewhere that wasn't this room and wasn't this body and definitely wasn't anywhere near the liability that was suddenly, mysteriously contagious. Caldwell paused at the door. He turned back and looked at Rachel standing by the wall, her hand pressed against her scrub pocket where the tarnished challenge coin was pressing against her ribs like a second heartbeat. His smile was the smile of a man who'd just moved a chess piece and watched his opponent realize the game was already lost. Don't touch him, he said quietly, his voice like a tank idling in a garage, heavy and powerful and entirely assured of its own dominance. Security's coming for you anyway. The door closed. His footsteps echoed down the hallway, moving toward the elevator with the confidence of someone who'd already won. Rachel stood motionless for 10 seconds. The heart monitor was still screaming, still tracing its useless patterns across the screen, still announcing to the empty room that something was wrong, that something had broken, that something needed fixing. She pulled her hand from her pocket and looked at the challenge coin for just a moment, that tarnished piece of metal that was the only proof she'd ever existed as someone other than Rachel Torres, the temp nurse with gaps in her work history that nobody could verify. Then she moved to the ICU entrance and locked the doors from inside, hearing the mechanical click of the deadbolt slide home. General Marcus Webb's body lay on the bed like a question that needed answering. His hospital gown was already soaked through with sweat and fluids and the evidence of a body that had fought too hard for too long. Rachel pulled the crash cart close, her movements precise and economical, and removed a scalpel and rib spreader from the sterile supply drawer, equipment that was supposed to stay locked away now, sealed in packages for some surgical procedure that would never happen. She tore open his hospital gown, exposing the scar tissue underneath, the old geography of trauma written across his chest in pale white lines like a map of somewhere she'd been before. 20 years. That's how long it had been since she'd seen this chest in the field hospital at Bagram, when this man was an 8-year-old boy pulled from underneath a collapsed market, when his small body was crushed and his heart had stopped while mortars fell around them like rain. His mother had brought him in wrapped in a blue blanket that was no longer blue, and Rachel had cracked his ribs then too, had felt them give way beneath her hands, had performed direct cardiac massage on a child's heart while everything was burning and falling and ending. The boy had lived. The boy had grown up. The boy had become a 4-star general of the Special Forces, and he'd just died because a doctor with a billing scheme and a network of pharmaceutical representatives had decided he was more valuable dead than alive. Rachel positioned herself at the head of the bed and raised the scalpel. Her hands didn't shake. Her breathing stayed even. She was about to do something that would end her borrowed life completely, something that would shatter whatever was left of Rachel Torres and announce to the hospital that a ghost had been walking their hallways all along. But the general's heart was still there underneath his ribs, and there was still maybe, possibly, theoretically a chance that a heart that had beaten once could beat again if someone was willing to hold it in their hands and remind it how. The scalpel found the space between the ribs and cut through. The scalpel cut through skin like tissue paper, Rachel's hand steady as a surgical laser, one fluid motion from the xiphoid process downward, 12 inches of precise incision, dermis to subcutaneous fat to muscle. Blood welled but not catastrophic, she'd timed it right, cut while his pressure was still barely registering, the body's reserves almost exhausted. The antiseptic smell mixed with something darker, copper and saline, the smell of a body in crisis. She set the scalpel down on the crash cart and reached for the rib spreader without hesitation, her movements mechanical, efficient, divorced from the enormity of what she was doing. This wasn't a procedure. This was a Hail Mary performed on a corpse that nobody wanted anymore. The spreader fit between his ribs like a key finding its lock. She positioned it carefully, the metal cold against her gloved fingers, and began to crank. Once. Twice. 3 full rotations. His ribs separated with a soft crackle, a sound like greenwood breaking, and his chest cavity opened like a book nobody was supposed to read. The fluorescent lights above cast everything in harsh white, shadowless, surgical, unforgiving. His heart lay there motionless, a dark fist the color of liver, wrapped in pericardium, utterly still. Completely lifeless. She'd done this before in a field hospital near Asadabad with nothing but a headlamp and a prayer, in the back of a Chinook at 6,000 feet with the rotor wash shaking the world apart, on a concrete floor in Sanjan Valley while rounds sparked off the walls. The setting changed. The procedure never did. Rachel placed both hands directly on the cardiac muscle, her palm against the ventricle, and began compressions. 70 beats per minute. The rhythm came from muscle memory so deep it lived in her bones, her hands moving independent of thought, the exact cadence she'd used in 3 combat zones, the pressure calibrated to compress without rupturing, to remind the tissue that it knew how to work. Her shoulders drove the force, her core locked, her breathing controlled and measured. 2 minutes passed. Her forehead beaded with sweat but her hands never wavered. 5 minutes. The monitor above showed nothing, still flat line, the electronic scream of a heart that had surrendered. She didn't look at it. She only felt the muscle beneath her hands, the dense resistance of myocardium, the texture like wet clay, waiting to remember. 10 minutes. Her arms burned, but she'd trained in far worse, in desert heat that cooked the brain, in cold that made fingers go numb and useless, in conditions where pain was information and information was survival. The challenge coin in her scrub pocket pressed against her ribs like a second heart, the tarnished metal a small weight reminding her she'd done this before, she'd saved a child when everyone else had given up, when the market had collapsed and the dust had settled and the body had been blue and cold and just as still as this one. 12 minutes. 14. Her breath came steady, her rhythm unchanged, mechanical and perfect and utterly devoted. The monitor stayed flat. The silence in the ICU was absolute, just the sound of her hands on his chest, rhythmic, relentless, the soft percussion of life being forced back into muscle that had already quit. At 18 minutes, the general's heart shuddered. Not a strong contraction. Just a tremor, a faint flutter beneath her palms like a bird waking in a closed hand. Rachel maintained the compressions, her rhythm never breaking, maintaining pressure while the organ beneath gathered itself, remembered itself, learned to beat again. 2 minutes more, the compression still steady, and then, sinus rhythm. The monitor above shifted from flatline to the familiar peaked pattern of a heart that had decided to live. His oxygen saturation climbed from nothing to 72 to 84 to 91. His blood pressure rose from absent to barely there to almost sustainable. She kept her hands in place for another full minute, watching the monitor, confirming the rhythm was stable, that this wasn't a transient response. When she finally removed her hands, his heart kept beating. Independent. Autonomous. Alive. Rachel began closure without ceremony, pulling the rib spreader back, the rib settling with a small click, her hands reaching for sutures, the needle driver precise, each stitch placed with the efficiency of someone who'd done this 1,000 times in conditions far worse than a clean OR. She sutured the pericardium closed, then the muscle layer, then the skin. Her hands moved like she was alone, like 15 doctors hadn't just walked out, like the hospital president wasn't already reviewing her employment file, like her career wasn't already burning behind her. The sutures were perfect, even, exactly what a trauma surgeon would have placed. She taped a sterile dressing across his chest and updated his chart in clinical language. Open cardiac massage sustained 18 minutes, return of spontaneous circulation achieved at 0318 hours, sinus rhythm established and sustained, vital stable. She wrote it like she was documenting a routine procedure, like she hadn't just cracked open a man's chest with a scalpel from a crash cart, like she hadn't just violated every protocol and regulation and law that governed what a temporary nurse could do. But that wasn't the worst part. The worst part was the next 3 hours of waiting, sitting in the supply closet with the door cracked open just enough to see the ICU hallway, watching his monitor on the tablet she'd hidden in her scrub pocket, watching the rhythm hold, watching the O2 stay above 90, knowing that every minute of stability was another minute before they fired her, before the state board came, before her carefully constructed temporary identity fell apart completely. She'd known it would happen the moment she'd made that first incision. She'd made a calculation in the space between one heartbeat and the next, save him or protect herself. There had never been a choice. At 0430 hours, the ICU door rattled against its lock. Security override. The sound cut through her like a scalpel. Dr. Caldwell entered first, his face arranged in careful concern, his tie perfectly knotted, his hands already reaching for his phone. Behind him came 2 guards in grey uniforms, and on speakerphone, the hospital president's voice echoing off the tiles. Dr. Caldwell's eye swept the room, took in the open suture line on the general's chest, the monitor showing strong sinus rhythm, the surgical tray with the rib spreader still sitting there like evidence at a crime scene. His expression shifted. Confusion first. Then calculation. Then a smile that could have powered a small city with its malice. "Nurse Torres," he said, his voice smooth as oil on water. "Security will escort you to the administrative office." He nodded to a woman in business casual standing behind the guards, tablet already in her hands, expression carefully neutral. "This is Dr. Patricia Helm from the State Medical Board. I've initiated an emergency investigation into fraudulent credentials and unauthorized surgical intervention." Rachel said nothing. She removed her badge from around her neck and set it on the desk with a small click. "Your employment is terminated effective immediately," Caldwell continued, and she could hear the triumph in his voice, the careful precision of a man closing a trap he'd been setting for days. "Your references did not check out. Your previous employment cannot be verified. And you've now committed a felony, performing surgery without a license, operating without physician supervision, violating state regulations on scope of practice." He handed her the envelope with her final paycheck, his fingers barely touching it, as if her incompetence might be contagious. Dr. Helm made notes on her tablet. "We'll need a full statement regarding your credentials and training." "She won't be giving any statements here," Caldwell said smoothly. "She's banned from this facility." "Security." Rachel walked past the guards without being escorted, her posture perfect, her face revealing nothing. Behind her, Caldwell was already making calls, his voice echoing down the corridor, one to the hospital president's office, one to the state licensing board, one to the pharmaceutical representatives in his network. She heard fragments as she descended the stairwell, fraudulent references, surgical violation, protection of hospital liability. The parking garage was empty at 0430 in the morning, just rows of vehicles and fluorescent lights casting everything in sickly yellow. Rachel found her Toyota where she'd left it 8 hours ago, the old Corolla that barely ran, that still had a background dust from 2 decades ago pressed into the door seals. She got in and locked the doors and sat there with her forehead against the steering wheel. 2 hours. That's how long she waited before she could move. The sun came up slowly over San Diego, painting the concrete gray, then pale, then finally gold. Her hands were still steady. Her breathing was still controlled. But somewhere in the last 18 minutes of holding a man's heart in her hands and reminding it how to beat, something in her had broken. She'd saved him. She'd broken every rule and violated every regulation and destroyed her temporary identity to save him. And now the hospital had her name, or the fake name she'd been using, her social security number from the personnel file, her bank account where they'd deposited her paycheck. She'd thought she could hide in plain sight, could be just another temp nurse, unremarkable and forgettable. But she'd made a choice. She'd chosen the general over the cover. And cover, once blown, was blown completely. Rachel lifted her head and looked at the hospital through the windshield, the glass catching morning light. Inside, General Marcus Webb's heart was still beating. That had to be enough. That had to matter. Even if she'd just traded her freedom to give him his. Security arrived at dawn with an envelope and a voice that didn't match her face. The guard, young, barely 30, with a nameplate that read Martinez, handed Rachel her final paycheck without meeting her eyes. "Do not return order," he said, sliding a document across the security desk. "Falsified credentials. You are terminated effective immediately." Rachel took the envelope. Her hands were steady. The paycheck was for $740. She'd worked 72 hours. The document cited credentials that couldn't be verified because Master Chief Petty Officer Rachel Torres officially didn't exist, buried under 6 layers of classification that turned her into a ghost the moment her operation in Bagram was sealed. She nodded once at Martinez and walked toward the parking garage. The fluorescent lights above flickered like they were Morse code for goodbye. Her Toyota sat where she'd left it 16 hours ago, a 2008 Corolla with a check engine light that had been on since 2019. Rachel opened the driver's side door, sat down, and pressed her forehead against the steering wheel. The plastic was cool. Cracked in 3 places from heat and age. She didn't start the engine. Didn't turn the key. Just sat there in the gray dawn light filtering through the concrete structure above, counting her breaths. 1, 2, 3, 4. The silence was so complete you could hear the hospital's vac system humming 2 stories above. 2 hours passed like that. Her phone never rang. No one came looking. The parking garage stayed empty except for the distant sound of tires on concrete and the occasional beep of a reversing truck somewhere on another level. She'd given them everything, 20 years of her life, her name, her identity, her future, and they'd handed her $740 and a do-not-return order. The general was alive. That had to be enough. It had to be. Her head lifted from the steering wheel when the siren started. Not ambulance sirens. Not the usual Seattle General sounds. These were different. Multiple vehicles. Authority sirens. The kind that made every other car on the road pull to the side. Rachel's hands tightened on the steering wheel. She didn't start the engine. She just watched through the windshield as red and blue lights began painting the concrete walls of the parking garage. People were running. She could see them now through the levels, sprinting toward the hospital entrance, their forms fragmenting between the support columns. News vans. 2 of them. Maybe 3. She'd never been good at counting when her pulse was moving this fast. Rachel stepped out of the car without consciously deciding to move. Her legs carried her toward the hospital entrance like muscle memory, the same muscle memory that had kept her alive in Sanjin Valley, that had taught her to move toward chaos instead of away from it. The automatic doors slid open and the lobby hit her all at once. The smell of antiseptic and floor wax. The sound of multiple conversations layering over each other. And then the television mounted above the reception desk caught her eye. A Pentagon press conference. The seal of the Department of Defense. And her face on the screen. Master Chief Petty Officer Rachel Torres. Decorated combat medic. 20 years of classified service. Missing since 2004. Sought for Medal of Honor ceremony. Classified missions now declassified. She stood frozen, watching her own history being read aloud by a Joint Chiefs spokesperson in a dress uniform that probably cost more than her Toyota. The photograph was from 2004. She was 26 years old, standing in front of a Black Hawk helicopter with her hair in a tight bun and her eyes already carrying the weight of things that couldn't be unseen. The news anchor's voice was clinical and detached. Her whereabouts have been unknown for 18 years. New declassification orders from the Pentagon have authorized us to release this information publicly. Anyone with information is asked to contact. The elevator doors opened behind her. General Marcus Webb emerged in a hospital gown, his chest exposed, flanked by 2 Marine guards in dress uniforms so crisp they looked like they'd been folded by origami artists. His scarred chest was visible, the long, precise 15-inch line that ran from his sternum toward his left side, still red from the surgery, still bearing the marks of her scalpel and her hands. His eyes found hers across the marble floor of the lobby. His voice, when it came, carried like a command across parade grounds, Reaper 6. It wasn't a question. It was recognition. It was the call sign she'd earned in the mountains, the name whispered in dark corridors by people who'd been pulled back from the edge of nothing because she understood that pain was information and death was just another problem to solve. The Desert Storm veteran, the guard on the general's left, a man with a scar that ran from his left eye to his jaw like a lightning bolt, snapped to rigid attention. His arm came up in a salute, fist to chest with a sound like a hammer on an anvil. His voice was parade ground loud, Master Chief Petty Officer on deck. The 2nd Marine followed. Then the nurses at the station. Then every person in the lobby who understood what those words meant, what the uniform meant, what the presence of 2 Marine guards around a 4-star general in a hospital gown meant. They stood. All of them. Slowly or quickly, depending on how fast their brains could process what was happening, but they stood. The morning news broadcast played behind them all, Rachel's classified history becoming public knowledge while the hospital itself seemed to hold its breath. The hospital president, a man named Sterling who'd worked there for 18 years and had probably never felt powerless a day in his life, stepped out of his office with a tablet in his shaking hands. His face had gone the color of weak tea. He stared at Rachel, then at his tablet, then at the television, then back at Rachel. His voice came out thin and reedy, "Your service record. I'm reading it now. The Pentagon sent it directly to me an hour ago. I don't understand." General Webb moved toward Rachel with the careful precision of a man still healing from catastrophic trauma. His hand reached for his gown and lifted it, showing the crowd the scar that bisected his chest like a roadmap of resurrection. His voice broke on the words, "When I was 8 years old, I was pulled from a collapsed market in Bagram. I was gone. Dead. My heart stopped. And this woman," he pointed at Rachel with a hand that trembled for the first time, "she brought me back. She breathed life into a dead child. Then she disappeared. And I never got to thank her." The room didn't just go silent. The silence became a third presence in the space, something so thick you could perform surgery in it. 3 seconds of it. 4. 5. The news broadcast played on, Rachel's history being announced to the world in real time. Dr. Caldwell stood at the back of the lobby, and his face drained to ash. Rachel watched it happen, watched the moment his brain caught up to the mathematics of his own destruction. The investigation he'd summoned. The state medical board he'd contacted. The system he'd weaponized to erase her was already processing his name, running his records, flagging the patterns that a competent investigator would see in 30 seconds. The pharmaceutical representatives he'd met with, the ones who'd paid him in ways that didn't appear in hospital accounting, those representatives were already cooperating with federal investigators because his scheme was secondary to something bigger. His phone rang. She watched him pull it out with trembling fingers. His face went grayer. And then grayer still. The investigator's voice, Rachel couldn't hear it, but she could read his body language like a combat medic reads vital signs, was informing Dr. Caldwell that his name had appeared in the background check he'd requested for Rachel Torres. That the state system had flagged his billing records. That his relationship with 3 pharmaceutical representatives was now being reviewed under federal fraud statutes. That his decision to call the medical board on a classified operator was about to cost him everything he'd built because the same state system that had been weaponized to destroy Rachel was now turning its full attention to the man who'd wielded it. Caldwell's hand dropped. The phone fell to his side. He looked at Rachel, really looked at her, and saw what he'd missed for 16 days, the steady hands of someone who'd held lives together in the dark. The composure of a person who'd already survived worse than anything he could build. The presence of a warrior who'd been polite about her suffering because warriors understood that true strength was restraint. The 15 doctors who'd walked out of the ICU 6 hours ago came forward one by one over the next 72 hours, providing statements about Dr. Caldwell's urgent warnings, his unusual insistence that they abandon their patient, his narrative about liability that now looked like an attempt to cover medical negligence while eliminating the one person who'd actually saved a life. The pharmaceutical representatives, facing charges of their own, provided detailed records. The billing codes that had seemed professional yesterday looked like fraud today. The ghost prescriptions written for patients who never received medications became evidence. Within 48 hours, Caldwell was suspended pending investigation. Within a week, his medical license was under review. Within 2 weeks, he'd lawyered up with a San Diego defense attorney who told him the evidence was overwhelming and the optics were catastrophic. The 15-year-old Porsche he'd financed with kickback money sat in his garage while he sat at a folding table outside a strip mall on Mission Boulevard, wearing a polo shirt with an insurance company logo, trying to sell supplemental health policies to people who wouldn't make eye contact. The world had moved on. Rachel Torres had become a hero. Dr. Caldwell had become the man who'd tried to destroy her. 6 months later, Rachel stood in the White House in dress white so crisp and white they seemed to glow. The Medal of Honor hung around her neck on its blue ribbon, the weight of it anchoring her to the ground. General Webb stood beside her in full uniform, his chest visible beneath his dress blues, the scar she'd given him a badge of resurrection. The president had asked her what it meant to save a life you didn't know you were saving. Rachel had answered in 3 words, "You saved them anyway." The room had erupted. Standing ovation. Cameras flashing. Senators and generals and the Secretary of Defense all applauding a woman who'd spent 20 years as a ghost. Her new office sat at the Navy Medical Center in San Diego, where she now trained combat medics as a senior instructor. The shadow box hung on her wall, mounted just above her desk, positioned so she'd see it every time she looked up from paperwork. The tarnished challenge coin sat in the center, the one she'd carried for 20 years, worn thin by her fingers, marked by dust and blood and time. Beside it was the photograph of an 8-year-old boy covered in dust, his face barely visible beneath the debris of a collapsed market in Bagram. And beside that was the Medal of Honor in its presentation case, the blue ribbon a splash of color against the weathered gray of everything else. General Webb visited quarterly, always in uniform, always with the same question, how many others did you save? Rachel's answer never changed, enough. She taught young medics the technique of direct cardiac massage, demonstrated hand placement on training dummies, showed them the angles and the force and the way you had to understand that sometimes the right choice meant losing everything else. On her desk sat a new challenge coin from the general's unit, polished and bright and perfect. She kept the tarnished one in the shadow box, a reminder of the 20 years she'd spent erased, and the life she'd saved that made it all worth it. She stood in front of a classroom of 23 combat medics, her voice steady and calm, her hand steady and strong. The quietest person in the room might be holding it all together. Remember that. The room went dead silent. Then all of them understood. If you love a good underdog story, hit that like button now. Subscribe so you never miss one. And comment below, have you ever been the underdog? Let's see how this plays out.